like to open our discussion. Any initial feeling?
You had to know I wrote that note, Zach. And you said nothing.
I think whoever wrote this is just looking for attention. Or maybe it's like a call for help. Then why not sign their name?
6.5 million people in the U.S. are in need of mental health care, but do not have access to psychiatrists. 16.2 million people in the U.S. have had at least one major depressive episode in a given year. 40 million people in the U.S. are affected by anxiety every year, but only 36.9% receive the treatment they need. My name is Zarian Griffin, and I am presenting with Beverly Ntagu, Shakayla Gray, and Daniqua Collier. This presentation will detail the disparities in mental health within Black and Brown communities, especially amidst the global COVID-19 pandemic. Well, what is mental health? According to the Oxford Dictionary, mental health is a person's condition with regard to their psychological and emotional well-being. A person's state of being has an effect on the way they think, feel, and act.
In Black and Brown communities, there is a large disparity in mental health. In 2019, 2 in 9 African Americans and 1 in 4 Hispanics aged 18 and older had a serious mental illness. Research has consistently identified 4 factors that play a role in these disparities. The first factor is SES. About 20% of African American and Hispanic populations live in poverty. This factor also plays a role in health insurance. In fact, 11.5% of African Americans and 18% of Hispanics lack health insurance. Both factors allude to a need for accessible resources for those who do not have access to a hospital or clinic. Another factor is cultural competency and communication. Black and Brown communities describe mental health differently compared to mental health organizations. This is not only impacting those with insurance, but also discouraging those from obtaining insurance. Lastly, family values and religion play a large role in stigmatizing mental health and negatively affecting people's help-seeking behaviors and coping behaviors. If this is data from 2019, what does it look like amidst the pandemic?
So how can a pandemic affect mental health? COVID-19 is the first pandemic in modern history, and its long-term effects are still to be determined. Public health mandates such as social distancing and lockdowns have restricted social connectedness and led to devastating psychological effects, including suicidal ideation, depression, anxiety, and increased levels of stress. On the left, in this graph, we can see that there was an overall decline in psychiatric emergency department visits during the span of February through May of 2020, which we can most likely attribute to the fear of going into the emergency department and possibly contracting COVID-19. On the right, however, we can see a statistically significant increase in the emergency department visits for suicide ideation in adolescents, which suggests that COVID has had a negative impact overall on mental health.
Mental health issues increased during the COVID-19 pandemic. In 2020, 35% of all adults in the United States suffered symptoms of anxiety and depression. 40% of the African American community and 38% of the Hispanic community expressed anxiety and depression symptoms. Specifically in the Black community, these mental health issues stem from uncertainty, isolation, grief from financial and human losses, police brutality, and divisive rhetoric. A call to action to address mental health starts with 3 steps: prevention, identification, and intervention. In the words of Dr. Katrina Peters, start with yourself. If you see something, say something. Here are some resources if you are struggling with mental health. On behalf of our group, we thank you.